Hi, I'm Dr. Chris Symeon. I'm a consultant psychiatrist and neuropsychiatrist, and I wanted to talk to you today a bit about mental health in brain injury. Brain injuries, for whatever reason, whether it's traumatic brain injury or another type of injury, can impact the brain in a number of ways. And individuals may experience a wide variety of either physical, psychological, cognitive complaints afterwards, but often the focus of treatment is on the physical because it's more tangible and visible. Sometimes the psychological or cognitive elements get overlooked, and that can have significant impact on people's quality of life and those around them. From a psychiatric perspective, it's really important to consider things like mood. So, very frequent and common presentations after traumatic brain injury might involve people experiencing depression, anxiety, emotional ability, and reduced tolerance to stress. So, having a kind of shorter fuse. Cognitive symptoms include things like memory problems, concentration problems, processing speed problems, so slow thinking, and problems with multitasking as well is a very frequent presentation. Behavioural changes can also happen. People sometimes find that they're a bit impulsive, or that they again lack that emotional control that they once had. They might become more withdrawn or notice changes in the personality as well. And realistically, this does relate usually to the nature and extent of a brain injury. For example, if someone has a more severe brain injury, they're perhaps more likely to have more severe cognitive and mood problems. But it's also the case that even very mild, or so-called mild, brain injuries can have really significant impacts on the things that I've just mentioned. So it's really important when you see a psychiatrist or neuropsychiatrist to work with them to understand all of those elements and to really pick apart what has changed since before the injury. You would usually be going through things like past history, development, past medical history, psychiatric history, and thinking about how the mental state has changed over time, and thinking about personal and social factors as well. Activities of daily living are also really important to consider. What could you do before versus what can be done independently afterwards? And also what needs help and assistance versus kind of direct support, or someone else to do those tasks, so that people don't become de-skilled. Treatment of the mood component of what I've discussed can be supported using medication like antidepressants. So there's good evidence for use of antidepressants in traumatic brain injury to support recovery and mood regulation. Sometimes we use other medications such as stimulators, basically. So they stimulate cognitive function and alertness, and those are particularly helpful for people that have a lot of cognitive fatigue. Usually treatment will be, again, interdisciplinary, so it would involve people like occupational therapists or psychologists to really support with those cognitive strategies, to think about where there are gaps and limitations, whether we can support with retraining, and if retraining is not possible, to think about adaptation, so using memory aids, for example, or even technology. So working with a neuropsychiatrist, these are the kind of things that you could expect to consider when treating a brain injury. So mood, cognitive and behavioural symptoms are extremely common after a traumatic brain injury, and in fact any acquired brain injury, and do benefit from full assessment and treatment. Thank you very much for watching.